Doctors could be on the brink of a breakthrough.
Migraines.
How to control them.
Tame a migraine.
A severe migraine.
Throbbing, recurring headaches.
Given all the noise, navigating the migraine experience can be confusing and scary, but you do not have to do it alone. Welcome to the Migraine Guy Podcast, the official podcast of themigraineguy.com and theheadachreview.com. Now, here's your host.
Are you a mother who also has migraines? Then you should go read this week's blog post from Sarah Cairo. Sarah wrote a blog post about being a mother with migraines and what you should expect. She talks about medications as well as breastfeeding. So if you're a new mom and struggling with some of the complexities associated with that, head over to theheadachreview.com, click blog at the top, and read Sarah's post today. All right, everybody. Thanks for joining the Migraine Guy podcast. Currently the only migraine podcast with weekly episodes. So thanks for tuning in. If this is your first time, hope you'll hit that subscribe button to be alerted when I do podcasts, or when I upload podcasts, every Thursday. Also, if you're listening to this podcast on iTunes, I'd really appreciate if you would leave a 5-star review as well as some kind words about why you like the podcast. That helps more people find the podcast when you leave reviews, because that shows the Apple algorithms that people like this podcast and that it should recommend it to others. So if you know other migraine sufferers out there, let them know about the pod. So let's get started with this week's episode, the way we are starting all our episodes now, with a little update on my migraines. This last week was actually fairly tolerable. I didn't have anything that kind of debilitated me. Everything was in the 3 to 4 pain range, basically, which if you're new to migraines might seem pretty unbearable, but over time you kind of learn how to cope with pain in that range. And I'm a big fan of distraction techniques when my pain is in that range. And distraction techniques are the kind of thing that you use to distract yourself. So if there's stuff around the house, for example, like last week when I went out and cut down some trees that were in the backyard, that was a nice distraction technique, something that kind of forces my attention away from my pain. Now, of course, it's really only effective when my pain is at that sub 4 level, but anything above that, of course, distraction techniques tend to not be the most effective, because the pain is just forcing my attention. Whereas when the pain is less, like it was this last week, working on the house, working on a paper, working out, helping some neighbors with automotive problems, it really was a pretty useful tool in my arsenal. And of course, it's entirely free. So who doesn't love that? So not a lot to update you on in that regard to my migraines, but thank you to every single person, and there were maybe a dozen or so, who let me know about time-released Topamax. I was talking about it last week on the podcast and why I was interested in it, and everybody quickly let me know that Trokendi is the time-release version of Topamax. So I immediately shot my doctor an email asking about it, and he replied pretty quickly, actually. Whoever created this one chart patient website that my health insurance and doctor use in order to communicate is actually pretty handy. It gives you all sorts of things about your medical history. It gives you a couple tools in there to use. Keeps your appointments listed, lets you email not only your doctor, but anyone really in the network that you want to ask a question to, which is kind of handy. It gives information on billing and, of course, some stuff about preferences. And so I'm able to talk with my doctor somewhat frequently when I have a question like this, and he responds pretty quickly because it's the system he uses, because that's why I'm enrolled in it at all. So pretty cool. I'm sure it's going to get hacked one day and all my medical records will be let loose on the internet, like Equifax has ruined credit for everybody. But until then, it's been pretty handy. So I went ahead and shot him an email asking about the Trokendi, and he said, sure, we could do it if you want to. And I asked what milligram dosage, and he then started asking me why I was asking so many questions. Not in a negative way. He was just wondering if I had some reservations about Topamax that he needed to know about, and I have told him about my reservations about Topamax in the past, but that's okay. Went ahead and re-explained everything in an email, And he said, well, if you don't want to try Topamax or it doesn't work, we do have 3 other options we could try. And the first one is a medication. The second one is another medication, but it's not for migraines necessarily. And then the third one was Botox. So I'm just going to run through these in order here. So the first thing you wanted to potentially try if Topamax didn't work is a medication called zonisamide. And zonisamide is an anti-seizure medication, which is pretty common for migraine prevention. I'm sure you've been on an anti-seizure medication or currently are. I have been on them. I wasn't a huge fan, but the side effects were pretty minimal. It just didn't help reduce my migraine frequency and intensity. He said that the typical starting point for zonisamide is around 50 milligrams at bedtime and slowly increasing up to around 100 milligrams if 50 doesn't help. And so that was, just a backup plan in case I don't want to go with Topamax. I need to go over some of my medication notes from the last time I was on an anti-seizure, because the big thing for me is cognitive side effects. I really need to be able to think. I need to be able to write. I need to be able to read. And so if you have experience with zonisamide, that's ZONISAMIDE, if you have experience with it, please let me know on whatever social media platform you like to use. I'm very interested in it, and I want to know your experience with it. So let me know all the positive, all the negative, because hearing from other migraine sufferers is a way to be informed about the possible, negative side effects that I should be aware of. So let me know about that. The second thing he said we can do if Topamax doesn't work well is to use tizanidine, which is actually a muscle relaxant, so clearly not for migraine prevention, more for pain management. He said he likes to start at about 2 milligram dosages 3 times a day. So I really don't like muscle relaxants. I've been on them a few times in my life for different reasons, and they either make you really, really drowsy all the time, which isn't the worst thing. I would love to get some good night's sleep, but I don't want to feel real drowsy throughout the day. I don't want to feel groggy. I don't want to feel unable to stay focused on what I am doing. But of course, at a low milligram dosage like 2 milligrams, it might actually help manage pain throughout the day in a way that would be beneficial to me. So definitely. And the upshot of a muscle relaxant, of course, right, is that it's out of your system pretty quick. So unlike some of the other migraine meds that build up in your system and take a while to get out of your system even after you stop taking the medication, muscle relaxant, in my experience, leaves your system, roughly in a day and doesn't really hang around, and there's no long-term issues with it. So that is a positive in its favor. So perhaps I will consider it a little more seriously than I was going to. I just convinced myself to potentially try it while talking to you all. Isn't that fun? Let's see, the third thing he said we could try is, Botox injections. And Botox is pretty cool for a variety of reasons. In the email he wrote, this has been proven to reduce migraine headache, which, is not wrong. And, there's a long history of Botox really, really helping reduce migraine frequency and intensity. The downside to it is that most studies, almost all studies, put it in that 50% success rate range, which admittedly is much, much higher than a lot of the medications out there that we have. But on the downside, that means, take any 2 migraine sufferers, Botox is only going to help one of them. And so I don't know which one I would be. Of course, we'd have to try it to see. Another thing to consider about Botox is that it's not, a once and done type thing. It's a thing you have to go back for, depending on how your particular practitioner is going to do it is up to them. But, once every couple of months is not uncommon. The Botox that they inject does wear off, and so you have to go back to get more Botox. And so it's just something to consider on top of that, right? It's not a once and done thing. This would be a commitment to go frequently to get it. And on top of that, you don't see results right away sometimes. Sometimes it takes your 3rd or 4th injection cycle before you actually start to see the pain reduce. So it's helpful to manage your expectations in that way. So, when he says this has been proven to reduce migraine headache, it's maybe he's just not a big emailer, so he just wanted to write one sentence, but it is certainly not the most accurate way to describe Botox's likelihood to help headache and migraine sufferers. But it's certainly something to consider if your insurance covers it, or if you just have plenty of cash and don't need insurance to pay for it, you might consider it as well. Now, someone did hit me up on Facebook. I don't want to give her last name, but her first name's Andrea, and she let me know if you are considering Botox or currently using it, that there's a website that she was only alerted to by her doctor after she started taking Botox. It wasn't the kind of thing that insurance told her about. It wasn't the kind of thing that she was made aware of in order to help ease the financial burden of Botox. But the website is, and so that's why I'm telling you, because you might not know about it, is BotoxSavingsCard.com, and I'll put a link to that in the show notes as well. But it's a little program, kind of like I don't know, CVS and Walgreens kind of have their rewards cards or whatever, and most grocery stores now have a way of giving you a rewards card. And this is a savings card, so I guess the more Botox you get, the more savings you get. But you have to fill out a little eligibility thing and see if you qualify and that kind of stuff. So I guess it's not guaranteed that you're going to get some financial help with your Botox. But if you are using Botox and need maybe some financial help or maybe a discount or something like that, I would definitely look into that website. Again, it's BotoxSavingsCard.com. Go check it out. And if it helps you out, let me know. I want to let other people know about it. If it turns out that it's just kind of a marketing ploy that doesn't actually help the finances, help your financial burden in terms of paying for Botox, let me know that as well. And that was great to hear from Andrea, so thank you for that. Let's see, we covered my migraine history and the medication options the doctor has said we can try if I don't want to do Topamax. So I think that is it for the migraine update for this week. So let's get to some migraine news. So in regards to migraine news over this last week, there was some very interesting information that came out in a couple studies that were published recently about occipital nerve stimulation. If you're not familiar with that, basically, if you're a fan of Star Trek The Next Generation, then this is kind of Borg-like technology. And if you don't know what that is, you should go watch Star Trek. But basically, ONS, occipital nerve stimulation, is the insertion, the surgical insertion of an electrode and a pulse generator into, the nerves in your occipital area in the back of your head. And there's a trial period where you use kind of a disposable one, and then if you respond really well, then they do the full surgery for you. And you get these implants in that help neuromodulate, that help control and activate certain nerves back there in order to help reduce headache and migraine pain. And it's an expensive procedure in a lot of ways, and it is certainly an invasive procedure. And so some of the research that's coming out now accepts the fact that ONS treatment can really help reduce headache and primary headache conditions like migraine and cluster headaches, but there needs to be a more precise way of figuring out which patients would probably be the best candidates for such a procedure. And so that's where the studies are now. They kind of have accepted that ONS treatment can really help up to 50%. Both these studies actually had upper 40, low 50 positive responses from their patients in the non-placebo group. And that was pretty interesting because that's kind of the gold standard right now for migraine prevention. Botox, for example, as I said earlier, kind of hits that 50% mark. So for any 2 migraine sufferers, Botox will help one of them. And even though that might sound pretty depressing because you would like something maybe in the 80 to 90% success rate, wouldn't we all? Right now, 50% is kind of the gold standard, and these ONS treatments seem to have about a 50% success rate as long as you meet the certain criteria. Now, the one study that I'm talking about this week that looked at certain criteria basically found that different primary headache conditions will definitely, will likely, i.e. 50%, see some success, and by some success, that's usually a huge reduction in migraine pain days throughout the month. And so it's certainly something to keep in mind. But of course, this is, it's not a new procedure by any means. It's been around since the mid 90s, but it's a procedure that I doubt most insurance companies are willing to cover, given that there are pretty inexpensive medication routes, and there is Botox, which many insurance companies are starting to cover for primary headache prevention like migraine. And so I haven't talked to my insurance company about whether or not they would cover this, or even if there's someone in my area who specializes in it. But hopefully this will go the way of Botox, and it will be the kind of thing that becomes pretty commonplace. It becomes the kind of, given the huge success rate relative to medications, it will become the kind of thing doctors really push for as a primary way to treat headache and migraine conditions, and that hopefully will force insurance companies to start covering it fully. I'm not exactly sure what the price is. If you have had an ONS, and there are different kinds of ONS, right? It's not just one size fits all. There's, transcutaneous ones, which are electrodes that just get attached to your skin. There's this the traditional occipital nerve one, which has the surgery associated with it. There's other kinds of neuromodulation devices like the Cephaly, and actually I don't even know if I'm pronouncing that right. Cephaly, the little thing you use some adhesive with and put on your forehead, and supposed to neuromodulate. The costs, I think, somewhere in the $300 range, and you need a prescription to use it. I actually, there's a company in, I think it's England, but it's at least in the UK, and they're currently getting the the FDA to approve their neuromodulation device, and they sent me a couple review models. And so I'm going to start using those probably on Monday. Let's see, today's Thursday. So yeah, on Monday, and I'll just use it. I need to look at the directions a little more clearly. I'm not exactly sure if I'm supposed to use it under certain conditions or not. So I need to get a little more precise on that. Plus, I'm, not terribly scared. It's just a tiny little battery-powered thing. But of course, I'm going to be introducing some outside electrical activity to the old brain, so I want to make sure that everything is in order. But these devices are becoming a little more popular, and that just means that there's a variety of ways that your doctor might be able to prescribe one of these or multiples of them, or request that the insurance pay for it. So it's a pretty exciting time. I as a lover of technology and a lover of sci-fi, the idea of having some electrical device implanted in me is kind of cool sounding. I know it's also probably a little scary sounding, but I think it's pretty cool. So it's pretty fun to think about. I don't know if there's anything else from these articles to talk about. I'll link to them, as I said. You can read the numbers there. Yep, that was all I wanted to cover about the occipital nerve stuff. But again, if you have experience with it, I know a couple people in our Migraine Guy support group have experienced it, and they've talked about it. They've gone through the details of the procedure in the group and kind of let us know what was going on. And they have seen huge reductions in cluster headaches and migraines to the point where they are actually able to start doing some physical activity. They're able to, not just have 1 or 2 days less with migraines. They're seeing, double-digit days without migraines, 10, 15, 20, 30 days. So that's really exciting, and just kind of speaks to how great it can be to have science actually doing some things for us headache and migraine sufferers. So hope this kind of stuff continues. And now it's time for your migraine tip of the week. Something to keep in mind about your migraines with your abortive is that you're usually, you probably already know this, the doctors are pretty good about telling you this part, you're supposed to take your abortive really at the first signs that your migraine is ramping up to the point where it's going to be debilitating. Now, if you get infrequent migraines, less than 14 or 15 a month, that might be a little easier because the symptoms are going to be a little more stark, and you probably aren't going to be jeopardizing your quantity of abortives for the month. But if you get chronic migraines or something close to chronic migraines, then the 9 or 10 abortives that you get throughout the month that your insurance is going to pay for isn't the kind of thing that you can just use as needed, because you're going to run out, you're going to get medication overuse headache or something like that. So you need to really maximize your abortive. And there's a study, this is another study in a long series of studies on this topic, but nasal Sumatriptan in this study was compared against the pill and was found to be vastly superior to the pill. And some common sense scientific knowledge would say something like, well, yeah, if you shoot it in your nose, you don't have to digest it. You take a pill, it goes through your digestive system and gets absorbed slowly. That's why, part of the reason, right, why they tell you to take the triptan at the first signs of a migraine is because there is this delay when you take the pill. But when you take a nasal injection, it's just similar to any kind of other nasal spray that you've ever used. I don't think it was Sumatriptan that I had. It was, maybe it was Sumatriptan. I don't remember. I was only given a sample, a 3-pack from my doctor. And they worked pretty darn well. I'm going to be honest, I did not get the kind of dizziness that triptans typically give me with the nasal spray. So that was pretty encouraging. And then after I got fed up with the one doctor I was seeing, I went to a headache specialist, and the headache specialist just, lambasted on nasal sprays. He's like, oh, they don't get into your system as much. They drip down your nose. If your nose is kind of congested, then you're certainly not getting the full use. I don't like them. And being the naive migrainer that I was, I just accepted what he was saying. He seemed to know what he was talking about. But studies like this show that one doctor's experience is not the way things necessarily are. And so it is important to, explore all of the options when you're talking with your doctor. If your doctor wants to get you on Sumatriptan as an abortive, talking to them about whether or not the nasal spray is a possibility is definitely worth talking to them about. Now, there are a couple and if they have the injectables, that would clearly be the superior entrance method. But, of course, that involves you stabbing yourself with a needle, so you might not be a fan of that. But, of course, if it means you're avoiding your migraine, maybe it is totally worth it. Now, there are a couple things to keep in mind here, one of which is cost. The pills are very inexpensive, right? Sumatriptan is really inexpensive to make. You can get your... with your insurance, at least, I think a 9-pack was like $5 for me. It's pretty inexpensive in that regard. But if your insurance doesn't cover the nasal spray, if they're only going to cover the pill because the pill's cheap, you can, for a 9-pack, you can look, you can basically, I don't know what I was going to say there. You're basically looking, that's what I was trying to say. You're basically looking at, $200 to $300 a month for the nasal spray. At least that's what some people who didn't have it covered by their insurance told me, that it was in the $200 to $300 range every month for the nasal spray. But they swore by the nasal spray. They said they hated the pills, but that the nasal spray was vastly superior and works almost immediately, which is really what you're looking for. And so that's just something to keep in mind when you're talking with your doctor, is not just what they want to prescribe, but the different ways in which you can get it into your system. Because if you can get a superior method, why not take it? Especially if maybe some of the side effects are going to be minimized. So that's definitely just something to keep in mind with your conversation that you have with your doctor. And again, I will put a link in the show notes to this study. All right, everybody, I think that is going to be the end of this week's podcast. Hope you liked the content. Let me know if you think that there are other topics that you'd like to hear discussed here on the pod, or if you know of some articles that either support or challenge some of the things that I have discussed today. I want to know about all of the relevant information. So make sure to hit me up on Facebook, Twitter, Instagram, or YouTube. Just search The Migraine Guy. If you want to head over to Facebook and like The Migraine Guy page, you'll be alerted when I not only upload new podcasts, but when I link to different articles and start conversations online about different migraine topics. I'm probably going to start doing a Facebook Live video maybe once a week. I'm not exactly sure if I can commit to once a week every week, but roughly once a week is certainly what I'm looking at. And it'll be somewhat like the podcast in that it'll be maybe a 10 or 20 minute Facebook Live video where we talk about some things going on in the migraine world. And the nice part about Facebook Live is that it lets you interact with people who are watching. So if you have questions you want answered, or you want to tell me why I'm wrong about something, feel free to do so. Just head over to facebook.com/The Migraine Guy page and hit that like button. And I think that is wrapping it up. So until next week, everybody, take it easy. If you want to help keep everything that the Migraine Guy does free, then you can become a patron over at the website patreon.com. That's patreon.com. Patreon lets people contribute funds to other people whose work they value. Becoming a patron does things for me, such as allowing me to buy new products so that I can do product review videos so that you know whether or not a given migraine product actually works before you buy it. It also helps me do things like upgrade the microphones and cameras for both the YouTube channel and this podcast. And more importantly, it helps me be accountable to you, my migraine community. You can pledge as low as $1 a month if you want to, and every single dollar does help. Just head over to patreon.com/themigraineguide to become a patron today.